Hospitals across the country are filling up with cases of COVID-19, the flu, and RSV.
Health officials worry holiday gatherings could worsen this tripledemic. We're joined now by Dr. Hlatshwayo Davis. She is the director of health for the city of St. Louis, Missouri. Just how concerned should we be about this tripledemic? Because a lot of people are sort of tired of COVID, but then there's RSV, there's really severe cases of the flu. What's going on right now? What are you seeing?
Yeah, Lana, this triple threat is very real. And RSV kind of started the charge, at least here in my city, here in St. Louis. We're seeing historic cases, hospitals full. My husband, who's a pediatrician in the ICUs, just overwhelmed at work day in and day out because the ICUs are full. Now it is flu. We have seen the highest numbers of flu in the past decade. And here, the curve is not even a curve. It's a vertical line up for influenza cases. We have already surpassed the 2017 to 2018 peak, and it is earlier in the season. And then you have with that, rounding out that triple threat COVID, which while we aren't in the peak numbers that we saw in the pandemic, we certainly have not lost COVID. It is still with us, and those numbers are beginning to increase too. So in totality, these respiratory viruses that we know always are with us in the wintertime are at record numbers this season.
Now, I'm wondering about one thing that, I've heard friends talk about, we've done some reporting on, and it's bringing back the masking debate. Clearly, it can help prevent COVID, just as vaccines do. But you're saying the numbers are so high, higher than ever with other diseases. Some doctors say, masking is crucial. Others say maybe if you mask too much, it could be detrimental to building immunity to other illnesses. I'm wondering what your take is on that, and if that might have to do with the fact that there's so many hospitalizations with other things besides COVID because we've been wearing masks so much.
Well, let me debunk the latter myth right away, because as an infectious diseases doc, one thing I'm always going to do, even if it's not popular, is say it straight. We may not like masking. It may be a sensitive topic, but as of December of this year, the CDC has recommended masking indoors. And that is because when used appropriately with high grade masking, N95 masks are shown to work. And let me tell you something for those of you, for the naysayers out there, those who think, we're all part of some conspiracy here. In the first year of the COVID-19 pandemic, when we were masking and on lockdown, they were the lowest number of cases of influenza that we've ever seen. Now, coming out of the pandemic, everybody outside, people are masking. We are now seeing record high numbers. So we know that masking not only works for COVID-19, but for respiratory viruses in general, because it decreases the ability of transmission. Masking alone is not the answer. We know that the strongest tool in our toolbox is vaccination. And so everyone should be getting their COVID-19 boosters and flu vaccines. I always remind people you can get them both on the same day. But outside of that, this is a multifaceted approach. You need to be increasing your immunization, your protection with antibodies through vaccination. You need to be masking indoors and in crowded spaces, social distancing, hand washing. All of this in concert is what keeps people safe.
All right, Dr. Hlatshwayo Davis, thank you for joining us. Thank you for all that you do.
Thank you.